Professor Raj Bardoli, I think. Ramsaran sir, welcome here.
Hello.
Ramsaran sir.
Yeah, hi. I'm from Newcastle in UK.
Okay. Welcome here, sir.
Thank you. Thank you so much. I recently published on COVID.
Okay.
Let me share my paper here.
Okay.
It's on technology, actually. Technology. Where can I share? Can I share here?
You can show in the chat room. In between, you will have a look and share it.
Sure. It's here.
Welcome, ma'am. Aparna Pandey, professor.
Hi, you can hear me well?
Yes, properly. I can hear.
Yeah.
Hello, Aparna ma'am. I was in political science at UOH. Yeah.
When was this?
Yeah. Hello?
Can you share your name and details?
Yeah, I'll send a chat message.
Did you find my article, Basu?
On your article is on?
It's there. I shared the link.
Okay. Well, we'll share and we'll discuss it.
Sure. Excellent.
Your name is Ramakrishna
Ramakrishna Reddy.
You are which batch of MA from Hyderabad?
2005 and 7.
Will be away.
I'll be awake. And then I poke myself out.
Yeah, whenever you feel like you go quietly. That's fine. That's fine.
Hello, Kamla.
Talk.
Hi. I'm not able. Yeah, I can see you now. Yes. Hi, Aparna. Hi.
But I can't see you. You haven't switched on your.
No, the host has start my video. Wait.
Ah, there you are. There you are. Yeah. Yeah.
Hey, already there are 45 people. Okay.
We have time, madam. We have around 6 minutes now.
Okay.
And I think Professor Margaret also joined now.
Okay.
Hello, I'm here.
Hello. Hello.
After a long time.
Yeah, I had lots of plans to visit India recently, but they've all been suspended. How are you, Sahu?
Fine, madam. Like this doing, and we remember you whenever there is a migration, gender, and all this area.
Yeah. Yeah, I've been enjoying your the webinars you've been hosting.
So these clips are synced out. Okay. We have Professor Vinod Khatria, Professor C.S. Bhatt also there. Ambassador Manju Seth also already came.
Hello, how are you?
So, we have time now. We can
Yes.
Hi, Margaret.
Hi, is that Vinod?
Yes,
How are you?
I'm fine. How are you doing?
Good. I've been I listened to your presentation on this fora earlier, which was great, and I saw you'd been on one of Anna's pandemic borders seminars.
Yes.
A lot of interesting things to keep
A
us
lot of
engaged.
interesting things happening. Yes, we must connect again.
Yes. Yeah. Well, I said to Sahu I had been planning to come to India, so we'll see. I suppose when we'll all
Yeah,
be.
right now travel is a big challenge.
That's right.
Yes.
There are about 67 participants.
Hello, Professor Kavala. Hello, everyone.
Hello.
Can you see me?
Not yet. I can't see you yet. I can
Okay.
hear you.
All right, super. I'm trying to fix a camera situation here, so I should be able to join. Thankfully, the volume works.
Kamala ji, namaskar.
Namaskar, Vinod ji. Yeah.
हम लोग
We've been
बॉम्बे में
meeting. हाँ, नहीं,
बॉम्बे में
बॉम्बे
मिले
में
थे
नहीं
लास्ट.
हूँ. मैं दिल्ली में हूँ.
अभी दिल्ली में हैं. अच्छा तब तो
और
इसके बाद
बॉम्बे तो जा नहीं पा रही हूँ अभी.
हाँ, अभी सभी लोग तो फंसे हुए हैं.
हाँ.
हमारी बेटी भी फंसी हुई थी, फिर वो उसमें repatriation flight में गई USA.
अच्छा अच्छा.
It was quite a lot of formalities was involved.
Air India, is it?
जी हाँ जी हाँ.
हाँ. Okay. मैं तो यहाँ आई 3 महीने पहले.
अच्छा.
To take up this visiting professorship in Shiv Nadar University.
हाँ अच्छा 3 महीने से हैं आप. Okay.
Almost 3 महीने.
और कब तक रहेंगे?
बस इस कब तक of course nobody can say now.
अच्छा.
But I was supposed to leave by end of May, that my assignment would be over.
End of May.
End
अच्छा.
of May, but now it looks doubtful. End of May I may not be.
End of May हाँ
Maybe
well touch and
June.
go. हाँ कब पता चलेगा कि फ्लाइट शुरू होती है कि नहीं.
Yes.
अगर खुलता है तो मिलना चाहिए. We should be.
Yes. I stay in the city in a place called Nizamuddin East.
Oh, it's not very far. मैं तो I've shifted out of JNU.
अच्छा.
अभी मैं वसंत कुंज में हूँ.
अच्छा.
साहू आया था हमारे घर पे, so he knows.
अच्छा.
Hello, Professor Kamala.
सब friends पास में हैं लेकिन मिल नहीं सकते हैं. Hello.
हाँ जी.
Hello, but here from Hyderabad.
Hi.
Hello, Vinod. Hello, Vinod.
Hi, how are you?
Very good. All is fine.
Yeah, nice to see you.
Wonderfully good.
Yeah.
I think this group has really brought us all together. Platform, very different.
Yes, last time I met Kamala ji in Bombay when I was actually going to Tezpur, your university. But because of the agitation, that was all locked down in December itself.
I would have been there on March 23rd, 22nd.
Now,
Yeah.
to start, will
Yeah.
Dr. Pandey. One minute.
Is Bridge around?
Okay.
Well, no, he's joining later. I heard that he's joining later.
Okay.
Okay. So since Professor Bridge Maharaj is not here at present, I think I will begin the meeting by welcoming you all. Good evening, everyone. I'm Aparna Pandey, and I welcome you all on behalf of GRFDT today for our panel discussion, which is titled as the Gender, Migration and COVID-19, Socio-Economic and Policy Perspectives. It is the fourth panel discussion in our series, and which covers a wide area of topics related to migration, diaspora, and transnationalism. I'm extremely happy that we have, like other panel discussions, we have a list of very eminent scholars for us to speak. And also, I'm extremely happy that a very eminent scholar like Professor Kamala Ganesh is going to be the moderator of the session. Professor Kamala Ganesh is the scholar in residence, Department of Sociology at Shiv Nadar University. She has taught at St. Xavier's College, SNDT Women's University, and was a professor and head of the Department of Sociology at Mumbai University. Her research interests have been in the areas of kinship, gender, feminist methodology, culture and identity, and diaspora studies. She was recently Senior Research Fellow at the Indian Council for Social Science Research, working on the theme of the Sri Lankan Tamil diaspora in exile in Germany. So you can see it is just a very brief intro of her. She has a wide range of work with her in this field. So, and especially the gender. So now I would like to invite Professor Kamala Ganesh to take over and moderate the session. Thank you.
Thank you, Professor Aparna Pandey, for your kind words. I also, on my behalf and on the behalf of GRFDT, welcome all of you for this fourth session on gender and COVID, with special reference to migration. I also give a special welcome to panelists who have come here, made it a point to keep themselves free, rather taken time off from housework, from washing clothes, from doing dishes, from cooking, from childcare, and also from professional work if you are working from home and made time to be here. Of course, you all know GRFDT by now, but I just want to mention a line or two because it's a very, very special band of, I would call them a band of volunteers who started as a small core group with small funding and now have grown into a large global network, again with minimum funding, but a very enthusiastic, active and innovative group of scholars, activists, policy analysts who have converted this lockdown into an opportunity because they have organized, this is the 4th webinar, and with truly global participation. So I think it's a great occasion to be here and moderate this session. Just a few words before I hand over to the speakers. Coronavirus itself does not discriminate, we know that, but our world is an unequal one. There is inequality between species. I mean, Homo sapiens are right now at the top, but I mean, COVID could topple us soon, we don't know. And there are also inequalities among the human beings, social, economic, cultural, on cultural parameters. So pandemic affects some people in some sectors more adversely than others. And in this, gender is a very, very important parameter. Now, in this period of the last 3 months, the notion of home as a refuge, as a safe haven, has really taken literally a beating with the lockdown experience, because we all know and we have read reports that domestic violence is on the increase and women are at the receiving end of domestic violence. Now, social distancing, another term and concept that we have grown familiar with now in the last few months. Especially, it is very difficult for some people, especially for the urban poor who live in chawls and slums in big cities like Bombay and Mumbai and to some extent Delhi. But I'm a Mumbaikar and I know what it means, not even to be poor, but even to be lower middle class and to live in such a constricted space that, and this affects both men and women, that social distancing sounds like a mockery of the way people live. Then the other thing is that women are still continue to be primary caregivers, COVID or not. And that means increased labor in the house when schools are closed, colleges are closed, workplaces are closed, and people are at home. Then it means that the work of women increases quite a lot. So especially the organized sector women with white collar jobs, they work from home. They continue their professional work more or less from home. And most of you do that. So the labor increase for women is not small. But there is some hope in this particular section, and we'll have to see when post-COVID studies come out, whether this experience has made it easier for employers to give flexi time, and whether it is a little easier to share housework with other male members of the family. I have some hopes there, but we will have to wait and watch. But what concerns us very much, especially with regard to the current topic on migration, is those people who are working in the informal sector and in low-end jobs. They are the most vulnerable section for COVID. They are vulnerable anyway, but they are also at the receiving end of the trauma and problems of the COVID experience. So the informal sector is now very prominent in developing countries, and it is characterized largely, I mean, it has the high-end, high-salaried professionals as well, but it is largely characterized by low-end jobs, casual labor, daily wages, people whose jobs are first to get axed in case of any problems in the economy. Now, migrants form a disproportionate part of the informal sector, as many of our experts will be telling you with statistics. And women also form a disproportionate part of the informal economy. So to be a woman and a migrant, that intersection is it's at the intersection of two vulnerable categories. And so you can imagine that when we are discussing gender, migration and COVID, we know who is the most vulnerable. I mean, everybody is vulnerable to different degrees, But when policy is being made, then you have to look at the most, at the bottommost, the most vulnerable sector. And that is the poor migrant woman, who is today the topic of our discussion. Now, migration is a gendered phenomenon, and a large proportion of migrants are made up of women, whether in globally, for example, at the moment this year, about 47 to 48% of migrants are women. Of course, there is variation between countries. Now, female migration conventionally is seen as a social migration, having to do with marriage migration or migration with family. But new research in the last decade or so is showing how married women migrants who migrate because of marriage or with family, with, let us say, an unmarried girl who is moving with her parents, they also join the labor force. So they are both economic migrants as well as marriage or family migrants. There is no such thing in the lower end of the spectrum as pure marriage migration. It is rare. But when they join the labor force, they also, for various reasons, join in the most vulnerable, in the weakest jobs where they can get thrown out very easily. There is a new category in developing countries from within this, in this informal sector, I would say, which is that of young single women who have some skills. I'm not talking about the high end, upper end of this spectrum, but I'm talking about women, young women, girls from middle class, lower middle class and working class families who are migrating with some skills which will be suitable in the new economy, who are migrating both to urban areas within the country and sometimes outside the country as well. They are in jobs like business processing units, or in let us say food processing units, or in beauty parlors, working in a range of skilled jobs, but with not very high salaries. And our special concern ought to be these women as well, because they are also in a vulnerable category. According to the International Organization for Migration, the World Migration Report 2020, nearly 3/4 of the service industry, and that includes domestic work, consists of migrant women. Migrant women, both within the country and outside, face different kinds of exploitations normally, which is that, but with the lockdown, where they are forced to stay in certain kinds of locations and unable to move out, there not only is their labor exploited, but there is also sexual exploitation. There are xenophobic reactions to migrant labor. In the best of times and under crisis situations, this kind of xenophobia becomes heightened and their access to healthcare is limited. So I think the poor migrant female labor should be at the heart of the COVID response. But how this can be, I think, is for us to discuss today. We have a whole range of experts here, and they are drawn from different countries, and their experiences are also in different countries. You have the list with you in the leaflet that was circulated. We will start with Professor Margaret Roberts, who is Professor of Geography and Environmental Studies, Wilfrid Laurier, University, Waterloo, Canada. Her research interests are in gender and migration, transnational networks, and immigrant settlement. Her current research focuses on gender and international migration of healthcare professionals and international student migration. So we will have Margaret, following which we will have two others, and then there will be a break where we will take up questions together. We will collect questions. You could put your questions in the chat box, aiming it at specific persons. If you have a question for a specific person, and at the end of the three, after the discussion, we will go to the next three. And I would request all the speakers to be brief and pointed. There will be time again for answering questions, and later maybe a wrap up again with each of the speakers. So now I request Professor Margaret Roberts. There is already some questions from the GRFDT for you. which we hope you will take into account in your presentation. And these are the questions which have already come to me. Why is a focus on gender and migration relevant for the COVID-19 situation? And what resources can we draw on? And the other question, feminist agendas, what role do they play in recovery in the post-COVID period? So the request is that your presentation should include these issues. Over to you, Professor Margaret Roberts.
Thank you. Thank you so much for the invitation. And I'm very honored to be part of this, activity. There have been a number of sort of very interesting webinars organized in light of the disruption of COVID-19. And I have been following the work of the GRFDT team. And so I commend you on a wonderful collection, and I'm very honored to be part of this group. And so thank you, Professor Ganesh, for that introduction. And yes, why is a focus on gender and migration relevant to understanding COVID-19? Well, I think you already outlined that very succinctly and very thoroughly for us. I mean, certainly the COVID-19 pandemic has brought to the surface the structural crisis in social reproduction and the increasing presence of migrant and racialized women, especially working in the health and care economy. Most of my comments will be kind of a North American orientation. I'm based in Canada. And so this is where I draw a lot of my current work from. I mean, certainly women's paid inclusion in the labor market has increased globally, but we know that men have not taken up much of the double burden of social reproductive tasks. And so what we've seen happen is that in many higher income nations, such as the USA and Canada, there's an increased reliance on often marginalized immigrants to provide child, elder, and other forms of low-paid care and domestic service. And so this process has been captured in the idea of global care chains, the work of Arlene Hochschild and Rochelle Paranis especially, but the idea that care labor is organized through global chains, and that these connections are across different locations, and they exploit intersectional divisions, including but not limited to gender, ethnicity, class, religion, and they're very much framed by an uneven spatial development. So this process has been intensified as governments have restructured welfare supports to the young, the old, and the infirm, and families have turned to these global care chains to fill in the gaps. And so this care labor, as Professor Ganesh indicated in her opening comments, has become essential to the functioning of the global economy. As she said, 3/4 of the service, these kinds of service sectors involve immigrant women, whether we're talking about internal migrants, especially in the case of India, but also international migrants. So it's essential to the functioning of the global economy. And yet it has been devalued and commoditized. And so OECD research has suggested that if this socially reproductive labor were fully accounted for in national calculations, it might increase GDP anywhere between 15 to 70%. So this is not an inconsequential sector of human activity that we are talking about. So my research has focused especially on healthcare workers, and this has become increasingly evident, the crisis here under this sort of COVID-19 pandemic. So 70% of healthcare workers are women. And while many conditions of work have improved, women remain less represented in leadership positions in health. And there is at least a 28% gendered pay gap across health occupations. And intersectional factors, as I mentioned, create greater vulnerability for both international and internal migrant and racialized women workers. So the importance of immigrant healthcare and allied care workers has become more and more apparent in light of the threat of COVID-19. On average, across OECD nations, 16% of nurses and just under 30% of doctors are foreign-born. And this has become evident when we've looked at the UK, the USA, Canada, parts of Europe, and especially when looking at the disproportionate number of deaths that have occurred in often relatively young healthcare workers. According to a recent report by MPI, for example, migrants make up 29% of physicians and 22% of nursing assistants in the USA. In the UK, 13% of NHS workers report a non-British nationality. And in Canada, 8.5% of nurses and about 26% of physicians were all internationally educated. So these frontline healthcare workers, such as nurses and doctors, have been prominent in the public's understanding of why we need to flatten the curve. But domestic workers, cleaners, personal support workers, and other care workers also carry a substantial burden in light of this crisis. Now, in terms of talking about gender, we should also mention that male migrant workers also made vulnerable to this crisis. And we've seen this in terms of construction workers in Singapore, who were made vulnerable to the crisis through overcrowding and lack of attention from public health officials. In the Gulf countries, we've certainly seen similar situations, but worryingly, we've also seen the demonization and the marginalization of these workers. And there's been inadequate recognition of the conditions of their employment and work actually intensify their exposure to the disease. And this is similar to migrant workers in meatpacking plants in North America, migrant workers in the agricultural sector, and of course, refugees and asylum seekers who have been made more vulnerable to these risks by the inadequate social protection and provisioning that's been made for them. So maybe I'll talk a little bit now about what kind of resources there are that can help us understand more about gender and COVID-19. And certainly gender disaggregated data is vital to understanding what's happening. We know this is relevant for men and women and for boys and girls, and that we've seen in work such as Caroline Corrado Perez's book, Invisible Women, Data Bias in a World Designed for Men, that we have an immense gender data gap, and this has a significant material impact on the lives of women and men. And again, some of those comments were earlier presented in the opening. I would just like to say there are a number of organizations that are helping to prioritize gender data awareness, collection, and utilization. And I thought for researchers and policymakers, many of whom may be on this webinar, it might be useful to share a few of those resources. I don't know if I can share my screen. Is that possible? Well, okay, let's see. Okay, I can't share my screen with you, so let me just read them off. So in terms of some of these useful resources, there is Women Count, which is the UN Women's Gender Data Program, which was created to improve how gender data is produced, used, and shared. That has inserted important analysis of what's happening in terms of COVID-19. DevX is a media platform for the global development community. They have partnered with Facebook to provide a gender data series, and they have 10 practical virtual events to create a better understanding of gender-related issues highlighted by the current pandemic. And they share important lessons on how to engage in gathering better data to inform the current crisis. Global Health 50/50, that's an independent evidence-based initiative to advance health and accountability for gender equality in global health. And a very interesting group, the ladysmithcollective.com, is a feminist research consultancy that helps internationalizations collect data. And they have developed a gender data kit to help governments and researchers, and they use WhatsApp. And they've already documented profound disruption caused by COVID lockdowns regarding migrant women's access to essential services in the Colombian and Venezuelan corridor. And so this really speaks to the earlier discussion about the rise of domestic violence that's been experienced under the lockdown. There's also the Gender COVID-19 Working Group based at SFU. It's a global group of researchers, health practitioners, and policy activists. They are sharing resources and expertise on topics related to gender equity, women's empowerment, human rights.
I am able to join this.
COVID-19. Okay, so they have produced a useful
paper in the Lancet. And then finally, the Global Action on Men's Health is an interesting group. Their mission is to create a world where all men and boys have opportunities to achieve the best possible health and well-being. But their approach is based on the understanding of the needs of both sexes and promotes gender equality. So I can leave it there and speak about the second part of my issue in the next round, if that's possible. I didn't want to take too much time.
Yes, thank you. Thank you, Professor Margaret Roberts. You have given, even in the brief time given to you, you have given a sort of a sweeping view on how important care labor is in the global economy and specifically the North American economy, and how the healthcare sector is dominated by migrants and women at certain levels, and yet how their work, while so important, is devalued in many ways, including pay and the kind of respect that it gets. So I think that's a very important point that you have made, and thank you for listing out so many of the resources that are available. I request participants to please put your questions for Professor Margaret on your chat, naming her, saying that you would like to her to answer, and at the end of 2 other papers, we will get back to these questions. Thank you, and may I now request Ambassador Manju Seth to please join us. Thank you so much for coming. She is a career diplomat, retired from the Indian Foreign Service in 2014. Her last assignment was as Ambassador of India to Madagascar and Comoros. She has extensive experience in India and abroad in dealing with diverse issues relating to international relations, governance, policy matters, administration, publicity, media, protocol, culture, and economic and commercial matters. Seth is an advisor now for international collaboration with Organization for Diaspora Initiatives, ODI, and an advisor with Umbra Foundation, which works on women empowerment issues. So I'm expecting Manju Seth's presentation to reflect her experience in India, in Madagascar, and in all the other places that she has been. I'm sure she will have something to say, which is of both of a specific and of a general nature. So to you, please.
Thank you so much, Professor Kamala. It is such a pleasure to be here today. Can you all hear me?
Yes.
Thank you. It's such a pleasure to be here today and to listen in and be a part of this very, very interesting webinar organized by the GRFDT, which is, as you said, doing excellent work and excellent. It's contributing the seminars, truth seminars, to increasing our knowledge on different issues related to migration and global migration as well. And today I'd just like to talk a little bit about migration in the UAE. But of course, I will mention a little bit about Madagascar also, where I was posted. Why do people migrate? The essential thing is to improve their lives, to make their sort of economic situation better. And many of these people from India who are migrating abroad for work. So many people who are migrating from India to different countries, including the UAE, go for economic reasons. And very often they are at the bottom of the socio-economic pyramid. They're not very well off, a large number of them. There are many, of course, going as professionals and highly skilled workers. But many of them are going for work, and they're very, because of this, they are vulnerable. And if you look at what has been happening in the Gulf, there are about estimated in the Gulf about 30 million Indian migrants who've contributed the economies of these Gulf countries. And to the UAE, it is estimated there are about 3.4 million. And we don't know how many of them are women. There are all kinds of guesstimates, but there are a large number of women in the healthcare sector, in as nurses, etc., and in the retail sector, services sector. And in addition, there are a large number who go as domestic workers. And these domestic workers are subject to a lot of uncertainties when they go there, because not many of them go with valid, what are called employment contracts. Many of them tend to go on visit visas, and then some of the employers convert them into normal work visas, and otherwise they continue to be exploited. They become illegal, and those who go or illegal, undocumented workers they become, and so they're completely in the control of their employers. And also because of the kafala system that is in place in the UAE, where the employer is sort of in control or controls the working conditions, and does not allow till he or she gives permission for them to change their employment. They cannot change their employment, and this leads to a lot of exploitation, both and abuse. There are many cases, many instances where our embassies and when I was working at headquarters in the division here, people received so many complaints. But unfortunately, these complaints could never be proved. And because of lack of evidence, it's his word, her word against his, or whoever, the lady employee or the employer or the male employee, whoever, because the control is so strong that they are unable to get justice or even get out of their employment that they have got into. And so this is and many of them who do manage to escape or run away from their homes where they face abuse, both sexual and physical abuse, become undocumented, and they live in small dormitories and get some part-time work somewhere where it's further exploited. And at the same time, now with this COVID-19 situation, if you see, there again, as both Professor Ganesh and Professor Maria have said, that many of them are the most vulnerable. They're at the bottom of the socio-economic pyramid, and they are also undocumented. So when COVID-19 has broken out, it has affected everybody, but these women or these domestic workers are the most affected. There are, I believe there are some male domestic workers as well, but their numbers are, and the majority of them are women. And so there's no social distancing possible, because either they are within the homes or they are living in small dormitories in different places across the city, in the UAE, and no healthcare is available. They don't have any access to healthcare, and social distancing doesn't arise because they are all living in small dormitories with 5, 6, 7 people in a small room, and so they don't have any recourse to getting health attention if they fall sick, neither for getting out. Now, the evacuation that is taking place from the world, right? India is evacuating its workers. Now, many of these domestic workers who are living in homes and are employed continue to face whatever exploitation, but the ones who are living outside as part-time domestic workers or living in these dormitories outside, they are in great trouble because they don't have documents. How will they come back? Even if they want to come back to the country, they cannot come back because they don't have documents. Because if they want to leave the country, in the UAE, they have to pay fines because they've been living, once their visa expires, there's a system that you have to pay a certain amount to exit the country. So unless these countries announce an amnesty scheme under which they don't have to pay those fines, these women will be left to they cannot move from there, even if they want to, even if they are sick, even if they're unemployed. So as in India, you will see, the migrant workers and the poor migrant workers are the worst affected, so too in the UAE. And there is a large number of these, so they don't even come into the statistics that we are talking of. We are saying there are 3.4 million Indian migrants in the UAE. They don't even come in. We're not even counting them because they're undocumented. And many of them have gone on visit visas. But this is a new thing that has been devised by many unscrupulous agents and employers in the UAE to get people cheaply, get them on work visas, on visit visas of say 90 days, promise them jobs from here and leave them there, take their passports away and just leave them with the employers. And then after for 3 months, 90 days or whatever their visas they are valid, after that they become undocumented. But they continue to stay there because they cannot come back. Because if you have to exit, They will say, what were you doing here for 90 days? If they say we were working, they face a prison term. So they're in a kind of non-win-win situation or lose-lose situation, whatever they do. And this has become a big issue for, in the UAE as in other Gulf countries also. But the plus point is, I'm told Bahrain has announced an amnesty, and they're thinking and they're hoping that the UAE will also announce one, because we have a very large number of workers. And in the UAE, I understand that I haven't got the exact figures because I was going through the various databases, but they don't mention the women. How many women are there? What is the percentage? There are a lot of guesstimates. Some say 1/4, some say 30%, but no one is sure of how many women workers, and especially women domestic workers, are living in the UAE. And now they will not even register to come out. And the other problem is that they're not even covered under the labor laws, because they are domestic workers. Up to 2 years ago, actually 2 years ago, I'm told the UAE has brought them under their labor laws. But even then, even though they are covered under the labor laws, only the ones who have their contracts, who go on contracts, proper contracts, they are the ones who are able to still use or be covered under the labor laws. But the minute their contract becomes invalid, so to speak, when they either are thrown out by their employers, or they want to, or they leave, or they sort of try and escape the harsh conditions under which they are living, they become undocumented or illegal workers. And so that becomes a very, very big problem for them. And now under COVID-19, if they want to be evacuated again, as I mentioned, they're unable to do so. And this exposes them to a really sad situation where it's a double whammy for them, where they are poor, they don't have jobs, and then they're not able to even come out of the country when they want to go back home, if they want to go back home. And many will not go back because of the money. They get some money while they are staying there. Of course, right now the situation is very, very fragile everywhere, where jobs are few and far between, but domestic, and as Professor Maria said, domestic work as well as healthcare and as caregivers, women are still wanted, so they will get some kind of jobs, but it has become a very fragile situation for them. I just briefly, I'll mention a little bit about Madagascar and then come back to UAE. In Madagascar, the situation was different. You don't have very many, the new diaspora coming in from India, but you have 3 or 4 generations of women diaspora who went there about 4 generations ago, 5 generations ago. They got married and they went. And when Madagascar was still a French colony. But after Madagascar became independent, there is a substantial number of mainly women diaspora who have become stateless. The reason being that at the time of independence, Madagascar did not give citizenship to everybody. You had to apply. And since these were mainly poor women who were living far away from the capital area, they were wives or even abandoned wives at times. So they had no access or no way of applying either for an Indian passport or for French citizenship. I'm sorry, for Malagasy citizenship. And so they were left out of the loop completely. They were invisible. And that's a term which we see in many of the studies of various, they're not visible, they're not in the portrait, they're not anywhere in the picture. They're just forgotten. And that's something similar which has happened even in the UAE. Now, if you see in the recent years, the UAE has brought out a number of reports showing the progress of women within the UAE, that is the UAE nationals. And there has been quite a marked improvement in their status in terms of empowerment, in terms of access to jobs for the local Emiratis. But again, the migrant women from South Asia, from say the Philippines, from various other places, they're completely out of the loop. They're not even in the portrait, as they say. I just wanted to also highlight one last point, that in the remittance figures as well. Though women, as nurses and they go as nurses, they go in the retail sector, as I mentioned, the service sector and the hotels, they still, they contribute huge amounts to their families. But again, there is no mention of how much they are remitting home. And so there are again no figures available to or data available to are also contributing. And as Professor Maria said, if they document the GDP, if they document or they include this in the GDP of any country, it'll add a substantive percentage to the GDP of any country. And so domestic work and caregivers, healthcare work, all that, and even housework, for women is totally not considered as economic activity, as an economic work. And therefore, women tend to be sidelined always. And I had a few policy recommendations which I'll make at a later date, at a later time, and I'll stop now. Thank you.
Thank you very much, Ambassador Seth. You have, I think, brought to the forefront with your use of the term invisible, undocumented, illegal sometimes. That is the basic issue. For example, the issue of migrant male workers in India has come very much to the forefront. Even photographically, we see the rows of people traveling, but the women are not so visible. Absolutely. You can argue that there are fewer women, but as we know, everywhere women become invisible because of their gender, and their problems are therefore not highlighted to the extent that they should. So thank you for giving us so many details about the condition of women workers in the UAE, in Gulf and in Madagascar. I'm sure there will be some questions on this coming up after the next presentation. So thank you very much. And we go over to you, Professor Aparna Rayaprol. Aparna is professor and former head, Department of Sociology, Central University of Hyderabad. Her areas of interest include gender studies, Indian diaspora, qualitative research methods, and urban sociology. She was the director of the Study in India program for 5 years at the university and was associated with it since its inception in 1998. And she has been closely involved with its academic as well as administrative responsibilities. Professor Rayaprol, there have been some questions asking whether some of the speakers can address the conditions within countries like in India. So maybe your talk, your presentation could take that on as well. So over to you.
Thank you, Professor Kamala Ganesh. And thank you to GRFDT, especially Sadanand Sahu, for inviting me to speak on this very important subject. Thanks also to Amba Pandey for being here and starting off the proceedings. Well, I think my task has become a little more easier, primarily because the other two speakers have kind of laid some foundations for understanding this entire kind of invisibility. So let me start off with why is the focus on gender and migration that you want us to actually talk about? And of course, I will look at the Indian context. Some of the heartbreaking images in the past few weeks of the spread of the pandemic in India are of the working class woman. Is my voice clear?
Yes, it is clear.
Yes, it is. It is clear.
Yeah, of the working class woman with the child on her back, walking miles to reach her native village, as the place of work, which has become her home, has either asked her to go back or left her with few resources to survive. And upon reaching her quote-unquote home, she got sprayed on with disinfectant in a most insensitive manner or got locked up in quarantine. This scenario seems to connote a generalized condition of homelessness. Her home does not want to welcome her back, just in case she's carrying the virus of development, of the dangers of the big city, while the city, for those whose perennial development she and her family gave their sweat and tears, and wants her to go back, as there is literally no space for outsiders like her to stay and maintain physical distance. The current global health crisis compels us to turn the lens back on the struggles and insecurities of migration and settlement. So dependent migration has been the lens, the axis around which a lot of the research on migration and gender has been done. And I think for decades, women have been kind of classified as dependent migrants. And it is, very strange that they have been classified as dependents, as in many, many contexts, they are in fact the primary breadwinners, the homemakers, they are the everything. So in the Indian context, whether you take the domestic worker who has moved from a scenario of having come as a migrant construction laborer to moving to either a dog walker, come car cleaner, come domestic worker, to moving to a cook, I'm talking about small but certain kind of upward mobility in a context in the home of probably another migrant of a middle class. So we have these layers of migration, women employed by women and urban women employers who are actually working to want these women who are working for them. The care economy is definitely the place which is extremely gendered, as both Professor Roberts and Ambassador Seth have eloquently told us in both contexts. Now, if we look at the care economy, we're talking of the domestic workers who include the child care, and I don't think anyone has mentioned, so I will, the large elder care givers that are there, especially in our Indian cities. We have an aging population about whom the current virus is making us worry about because they are more vulnerable, but we have a population of domestic workers, mostly female. The care economy again prefers to have a female worker inside the home rather than a male worker. So the focus on gender and migration in all directions and in all its multi-layers and intersectionalities sees poor, often Dalit or Muslim women who are the caregivers and the ones who are completely invisibilized. So if they are so invisibilized, how are we able to, look at them and see them? So one of the things is, the way we do our research, the way we collect our data, and why is as academics, we also need to see that we don't invisibilize the worker. Who is this worker and how are we able to do it? One of my students had done a study in Nagaland on street vendors, and some of these women had actually said, why do I need a bank account? So what do you do, was asked. And they said, no, we sell these perishables. And at the end of the day, we are the ones who have to take home. And they are, of course, migrants to Dimapur. And they say, what is the man doing? And it is actually nothing. So what is the meaning of nothing? He's just lying. He's addicted. So whether it's alcohol or drug, there is a burden of the male addict who is supposedly the prime earner in our data, in our statistics, who is completely taking over because psychologically and ideologically, he is still the head of the family. In that sense, how are we able to, turn the lens? How are we able to actually look at some of these women who are in effect the primary earners, but the most vulnerable? And as Kamalaji has pointed out a little earlier, I think we also need to understand the violent circumstances in which they live. Today, with the crisis where everyone is at home, where they cannot, and it's impossible for them to maintain the social distance, which privileged people like us are able to maintain. And in that situation, men without work, and as studies have shown us over the last century, it's the men without work who become the most violent in these circumstances. So it's a double whammy of sorts that is there. The second point that I will address, of course, is what are the feminist agendas? Well, the biggest feminist agenda is to make visible the invisible. and to how do public places become much more friendly to the women migrant workers. Let's start with the very basic. You know, there have been documentaries like Paramita Vora's Q2P that has looked at our nation's capital and Bombay and Delhi, both as places where we have not been able to actually provide basic facilities, no toilets for women. So there is that is going on, I think, in a situation where these women are completely unwelcome in these public spaces. So sanitation, healthcare, primary, I think that is where we need to talk about. We need to talk about public health facilities where these people can go in. Several of these women, when they are pregnant, are not able to go in and get themselves tested. And when they go into pregnancy and childbirth, when they come back, they lose their job or they go a notch lower. So downward social mobility is again very, very gendered. If you look at who is the one who's most vulnerable and who in the stratification ladder, it is the poor Dalit Muslim women. You know, so we need to understand that in today's world, the feminist agenda is really to make, visible the invisible, to also look at the large amount of remittances. Say somebody mentioned I was looking at the questions on the side and somebody was talking about the nurses in Kerala. And if nurses in Kerala are the ones we are talking about, if we look at the remittances that they have given, I don't think it will be very, very different from the Filipina case, where the women are the ones who are really the backbone of the nation's economy in Philippines. So I think we need to understand, and like Saskia Sasan said a couple of decades ago, the nannies, maids, these are the ones who, whether they cross borders that are international or national or local. So we have rural to urban, we have rural to small town, we have small town to urban, we have national to international. So I think the Indian context today is very, very shaky as far as migrants are concerned, whether it's male or female, whether it's the taxi worker who is the aggregate taxi, the Uber, Ola, the male migrant who's completely, dependent now probably on his domestic worker mother, again, for his survival, and have the tables turned again, or did the tables never turn? Was she always the one who was supporting the family and supporting the economy? So I think one needs to not just add women, but look at it from the centrality of gender and of course within the larger intersectionalities. I think I'll stop for now, if that's okay, and then take up the questions a little later.
Yeah, thank you very much, Dr. April. I think you took on straight the very important point of what kind of categories we use, we as researchers or as reporters, that we also assume certain categories which make women invisible. And I think your question of your using this term dependent, how this dependent is used for women when they might have gone there initially as dependents, but they soon get into the economy. So they are also part of the economy. And how we unthinkingly use the word male breadwinner, where the male may not be winning the bread, and the woman would be doing at least half the bread, half the loaf of bread she would be bringing. So the importance of making the invisible visible is actually the agenda of feminism. And we see that even in such a thing as a COVID-19 situation, there is a lot of gendered impact. And so policy has to be sensitive. Of course, you might say, now what can we do besides lockdown and social distancing? Even if it brings special problems to women, do you have an option? This kind of question. The answer is that response to the situation, even within a lockdown or within social distancing, can have a particular focus on the most vulnerable, which are actually migrant poor women. So thank you for that presentation. Now we have had 3 presentations and I have collected some questions. There are some for Professor Margaret. There is, I would request those of you who have sent the questions to Professor Margaret to say it out. I think we'll begin with Professor Kadria, and there are 3 or 4 questions to her. We will collect those questions and then Professor Margaret would respond. And likewise, we will do the same for Ambassador Seth.
I've actually made a note of the question, so I can just go straight into answering them.
Okay,
that
you
would
have
be
already
nice.
read them?
That would be nice, yeah.
Okay.
Yeah, I've made a note of them. So
maybe you could just mention the name of the person who has asked the question. Yeah.
I have. So thank you for the questions. So Professor Vinod Kadria asked about whether the whole issue of ethical recruitment of nurses will become an important issue in the wake of the COVID-19 pandemic. And I mean, we're not clear yet, but I had some comments about a kind of a feminist agenda for remaking the economy post-COVID. And I would argue that we probably need a recommitment to global health diplomacy, and that would include the World Health Organization's 2010 code on the ethical recruitment of healthcare workers. So I would like to see that recommitment to the ethical recruitment code. So I would like to say, yes, I do think that is going to become important. Obviously, I don't know if that's going to happen. But I would say, in response to your question about the issue of ethical recruitment, I think it will become more important, and we are seeing some of that already happening. There was a question from Annie Yemanar about male nurses and the vulnerability of male migrant nurses in light of COVID-19. This is a very interesting question, and my own research has found the increasing rate of male nurses who are enrolling in the profession. And my theory is that, especially in the Indian context, nursing has become appealing because of its migration opportunities. So male nurses are explicitly looking at that opportunity to engage in international migration. So in some ways, you could argue that there might be a vulnerability because their investment is motivated by not necessarily the vocational aspect of nursing, but on its international opportunities. But research also indicates that male nurses tend to do better than female nurses. So that discrepancy in status and salary maintains a gendered one. And so male nurses do tend to do well if they select a feminized profession like nursing to enter. So it's an interesting question, and probably much more could go into it. Roshan Mova has asked about a lot of very interesting questions. I can't answer all of them, but what I will say is that it's really about this intersectional analysis. And so Roshan asks lots of questions about vulnerability, about which groups are at most vulnerability, how caste comes into play. And so I will say, yes, it is all about intersectionality, and this demands very close research and analysis from individuals who are very familiar with the context. Apna Joshi asked a really interesting question about how the pandemic is different from partition. Again, I'm not necessarily the one to answer this question. I think there are many people on this call who would probably have thoughts on that. But what I would say is that it's really about the forms of violence that we are seeing emerging in this kind of disruption and others. So again, I'm not really necessarily able to answer that, but it's a very, very good question. Robert asked about, whose work is in the idea of performing the diaspora. Robert asked, how do we challenge these failed economic models that he sees really undergird the whole notion of economic migration, right? So this is the idea that migrants move because of the failed development state. I mean, this is a good question. There's a lot we could go into, but the second sort of round of comments I had was about this notion of adopting a feminist agenda for coming out of COVID. And part of that is the notion of solidarity. And we have to really understand what solidarity is in terms of rights and about how people can demand those rights. And so for those individuals who are left in the cracks of the failed development state, that's an interesting question to engage with. I would also pick up on Shweta Prasad's question. She asked about illegal or let's say undocumented border crossers. I think Ambassador Manju answered that question quite well in terms of what are the excess vulnerabilities those individuals face. But I will make a comment about that. If states have such complicated migration processes, they are in effect funneling people into these other opportunities. And so if the only way individuals can kind of engage in those opportunities is to get a 3-month visa and then go as an overstayer and become undocumented, then part of that is a problem with the not having adequate migration corridors that people can attempt to utilize in order to seek out a livelihood. Thank you. I hope I got those questions.
Thank you very much. We now move over to Ambassador Seth. If you don't mind, there are several questions for you. Could you read out the questions and then respond to them?
Yes, certainly.
Yeah.
First is from Rama Kumitha, and saying that in 2017, Indian workers around the world sent $69 billion back home, and 19% of these remittances went back to Kerala, the highest proportion for any state. I think it's just, I was saying for women, it's not the proportion of remittances. What are women remitting to the country and how much are they contributing to GDP? But he's given the general information, and I say, yeah, and so I agree with that, that yes, Kerala is of course the most sort of remitted to state in India, because maximum number of migrants especially to the Gulf are from Kerala, from the state of Kerala. And they also have this special website for non-resident Keralites, the NODCA, where they have, where they document all this information, as well as workers can register, and that is another question. I'll come back to that later. But they can register, and for the repatriation, for even coming back, and for facilities and re-employment, reskilling when they come back. But I'll come back to that later again. And the next question is from Professor Binod Khadria, saying, how do you think COVID-19 would help initiate a rethink on the gender issues and migration of domestic workers, as it has been flagging the issues of environmental abuse by man? I think we will not be, from the government's point of view, I don't think we'll be able to regulate it, but we have put in place a number of checks and balances to what is called the immigration clearance requirement. The unscrupulous agents are able to even bypass that. And when I talk of this immigration clearance required sort of clause, it's especially for people who are not very skilled, who are not able to, and who could be open to exploitation. And for that, we have a specific sort of criteria that a person going to any of these so-called ECR countries, or the immigration clearance required countries, especially people who are unskilled and not very well educated, to have a proper work contract in place, which is vetted by the government, not exactly directly by the government, indirectly vetted by the government agencies. And they have specified certain agents who are cleared by the government, appointed by the government, to vet these contracts, and then only permit them, and to ensure that they have proper work visas, and then only they go abroad. And also for domestic workers, we had put in place a 30 years limit for women workers to go as domestic workers. And because we cannot stop, when we say rethink on gender issues and migration, I think we cannot stop women from going, and we should not stop them from going, because they are able, and the other thing that I want to mention is that they should not be called unskilled. Domestic work is also skilled work. You're required to have certain skills to be able to domestic work. The fact that it's a woman's job is generally, I think, classified as something which is not, doesn't require any specific skills, and there's no specific training, but there are skills required. And I think what we need to do is to skill them, to upskill them to basic, further, they have certain skills of housework, but or of domestic work, but to give them more skills, and to ensure that they have the right, the contracts are fair, and to also ensure that their conditions of work are met in their contracts. And that very often does the host government and the host employer or the host agency on the other side also is careful when everything is vetted by the government on this side. It does act as a kind of dampener on exploitation. Of course, as other as Professor Mario also said, and Professor Panna also, that people who are in the skilled category, for them when they are migrating within the country or outside, for them highly skilled professionals, they are very aware of their rights, of their conditions, work conditions, and so they are not that exploited. So whether they are women or men, they are less liable to be exploited. So we cannot really say that domestic workers, we should not send them, or we should rethink our approach to not sending them or not allowing them to migrate. No, we should allow them to migrate, but we need to ensure their safety, their proper wages, proper contracts, in something like what the Philippines has done. The Philippines government has a program for, we also had, introduced that program, but somehow, as I mentioned earlier, many of the domestic workers are taken out on, quietly on visit visas, and then, made into domestic workers and exploited. And there were also cases, when I was here on this side working in that particular division, of luring them, as, saying that or getting married to them. Young girls were being married and then taken abroad and made into domestic workers or sex slaves and etc. It was a terrible time when every day we would get at least, these are the ones who came forward. There were many who didn't come forward. And we got about 5 or 6 cases almost every other day, coming to us saying this has happened to our daughter. She was only 13 years old and now this is what has happened. We said, why did you send her, No, they gave us money, they gave her 2 lakhs or 3 lakhs or something, and they said, okay, she's got married, and we thought she's got married, but it wasn't the case. So to avoid all these abuse and exploitation and misuse of them, we put in the ECR, or the immigration clearance required, and now more or less we have been able to, if they go on work visas, we have been able and go with the proper procedure. And so awareness has to be created, skilling has to be done, and ensure that their wages are, their work contracts, give them fair wages and access to healthcare. That's what we need to do. And we have done it to a great extent, but we have to now stop these, exploitation through visit visas being, misused for purposes of domestic work or other other kind of work which is illegal in that particular country. So I think that is where we need to move, rather than stopping migration. And the issues of abuse by man, I think I cannot, I think men think, it's not a very nice politically correct statement, but I think men, especially in most countries, they're so patriarchal in their approach, especially in the Gulf. It's changing worldwide. I'm not saying everyone is like that, but they do think that they have a right to a woman, whether she likes it or not. If he wants her to be with him, she has to agree. So unfortunately, that mindset or that approach has also been a big factor, saying that, once you're employed in my home, I can do what I like with you. And very often their wives are complicit in that, because they say, she's a thing, she's not a woman, she's not a person. So that kind of attitude, I think, also contributes to sexual exploitation. And it needs to be changed. It's changing, but a lot more needs to be done. Another question from Anu Chatterjee: how can international diplomacy between two countries address the worrisome situation of migration? We are already, with many countries, we have already signed contracts, social security contracts, and we are, so that, the welfare of all levels of workers are safeguarded. And we have done that. And in international diplomacy, one of the main sort of purposes of diplomacy, and the fact that we work abroad, is, of course, good international bilateral relations, but to also ensure the welfare and well-being of our nationals when they are abroad, and to ensure the best possible conditions, work conditions for them. And with all countries across the world, very often we are able to, sometimes of course we come up with barriers, but by and large we have signed these social security arrangements and agreements and ensured that the situation of migration is, the condition of migrant workers is safeguarded. Of course, to stop migration, I think may not be possible for anyone, because migration has been taking place for millennia. For millennia, you can, if you go back into history, you'll see people have migrated. Some of them, the first migrants, for Madagascar, for instance, where they came from, the first migrants, they came from Indonesia. And so many of them are ethnic Indonesians, which is something which I was a little surprised when I went there. But how did they come with the winds, with the monsoon winds and seas? They would come on a boat, and they came for whatever economic reasons or just exploring. So, migration has been taking place for millennia. And I think human beings are generally inclined to migrate. For whatever reason, they like traveling, they like to go and settle in other places. And that's what you will see. Human history is full of migrations and migrants. So we can't really stop migration, but yes, to ensure that migration does not adversely affect our nationals, and that's what we need to aim at. And then somebody said, argue that domestic violence against women has increased during lockdown. What are the main reasons? But this is not really to me, but yes, domestic violence, yeah. Sorry. Can't hear.
I thought we could take more questions at the end.
All right,
because
okay.
we do have 3 more presentations, and Dr. Raiprol also has to respond. And then if we have time, we will take these questions again.
Okay.
So, Dr. Raiprol, if you could respond to some of the questions to you and everybody. There are some which are addressed to everybody. So maybe you could take 5 to 6 minutes, and then we will move over to the next speakers.
Certainly.
Sure, thank you. I'll start with Professor Khadria, and I'd like to combine Randhir Gautam's question with that as well, because they are similar. Professor Khadria says, how do you visualize childcare and creches run mostly by women to facilitate other women and mothers' labor market participation would be affected either positively or negatively by COVID-19 dislocations? And Randhir Gautam's question is about marital relations. So the reason I want to combine the two of them is that when you look at the middle class, workers, whether male or female, I think in 2020 at least, we are going to see a lot of scenarios of work from home. So when you talk about middle class families and work from home, I think we need to also put a positive spin on it and look at the contribution that men are finally making to household and childcare and family care. Of course, when men's contribution is far more to childcare than to domestic work, but still it is there. So when you have the male working from home, we would imagine that especially the young men who are in their 20s and 30s and 40s now are contributing, I hope equally, but definitely not equally, to the household. And ideologically, it should not be seen as helping, but it should be seen as managing the home, where everyone has an equal responsibility. So Randhir, I think in that sense, marital relations from the previous generation should definitely change. As far as the poor are concerned, the men's contribution has always been there in different ways, but ideologically they may not feel that they're contributing, but in reality they are. For instance, you see the male security guard often bringing the children with him to his workplace and putting them on the bus, because it's far more convenient for him to do that. And so, or if the woman has to have early domestic work, then his contribution is to get them ready and send them to school. So whatever it is, they have no choice but to share that labor. So the participation of women and men would definitely change. The men's participation would increase, and I think should increase. If it's not increasing, there's no choice, but it should increase. So it is a reality where they have to do that. Now, the other question is from Alok Kumar, and that is about reverse migration. My current research is really on reverse migration, and yours is specifically what will impact of reverse migration on supply chain and global economy. Now, one of the things that I would say is migration studies has always looked at post-migration and voluntary migration, as most of us know in this group. And when you look at this, can we look at this scenario where some of this reverse migration is forced? But before this, in the last 10 to 15 years, the reverse migration has surely been of a voluntary nature, especially when it comes to the IT, the global IT worker, who has had a choice in working, from Hyderabad rather than Seattle for the same salary, where the dollar goes a lot more. And then you have the return migrant who is also investing in the reconfiguration of the city. So, putting in a lot of investments. But now with all these cuts, there is also the reverse migrant within India who, a very sad state, as we are all talking, you can see millions of migrants who are walking home, who are dying on their way home, who are struggling to reach home. But the idea of home is very important in their mind. And the idea that at least at home there is someone to take care. And here they are nobody. Like I was talking to someone who said that there was this young couple from Orissa who had just been married and moved. And they both thought that they will be in this IT company in the kitchen. And suddenly now they find whatever it is, they will go home. So they got on to this lorry and they're still struggling. There's no response whether they have come. There are many such stories. So how will reverse migration on the supply and global economy is, of course, it will have a major impact. There will be a lot of people looking for jobs and taking jobs which are at a much lower place. So they will be exploited and there will be people waiting to exploit them because they themselves have taken huge losses, have borne huge losses over the last couple of months. So we have seen an unprecedented change and a depression in the economy. And of course, the reverse migrants are going to be both adding to the labor and being extremely vulnerable. Now, the healthcare workers are going to find jobs much more than anybody else. So anyone who is willing to be in the caregiving healthcare, male or female, as hospital staff or as people who are helping at home or in urban areas and rural areas, I think will have a lot of things. I'll move on to Maria Aishwarya's question on, how do we empower migrant women construction workers? And are we going to have laws as, the most vulnerable? Who is the most vulnerable? Well, we know, all of us do know, and the state also knows who is the most vulnerable. And I'm sure there is enough data, and there is NGOs and others who are giving that data on who's the most vulnerable in the informal sector and understand their documentation. And how do we stop these exploitations? That is something that we need to write in to the policy itself. Kunal, colonial dimensions to issue of, migration and gender. Well, from partition, we have had a lot of writing on gender, starting with Urvashi Gutalia and so many others telling us about the vulnerability of women, how people actually left out that completely. And so there have been different kinds of border crossings. So border crossings worldwide have always had violent situations for women, wherever in the world, wherever in our country, and things have been very, very difficult. And how, there has been a lot of research on this. And I think for instance, I do have another student who's working on the Muzaffarnagar violence currently, and that also is a different kind of migration and a different kind of movement. But then in what ways have women struggled, not just from invisibilization, but from many other factors. Priyanka, yeah, I lost you for a minute, sorry. Yeah, now it is, can we talk of the mental health of PCOS patients with severe anxiety? That I think I am not equipped to talk about, but I could address the second part of the question when you're talking about whitewashing of PCOS on an international platform, especially when invisibilization of women from time and again has made them lag behind. So, yeah, mental health definitely is a big issue. All classes, I think the lockdown has made mental health a very, very difficult phenomenon. As teachers, we are trying to see how we can cope by telling, by dealing with mental health of students themselves. So, of course, of migrants, this is a major issue as well.
We wrap up, Aparna?
Yeah, okay.
Yeah, and maybe at the end we can come again if possible.
Definitely.
Okay. So let's move over to the next set of three presenters. The order of presentation would be Ms. Paddy Sianka Natsen first, then Professor Faiz Omar Muhammad Jami, and finally Professor Annapoorna Pandey. Ms. Paddy Sianka Natsen is a Zambian national, currently resident in Malaysia, and holds an MSc Financial Economics from SOAS and BSc Development and Economics from LSE. She is a development economist by profession, currently a migration governance analyst with long experience in fields like governance, regional integration, and specifically working on migration and public finance management as her preferred bundle of interests. She has worked for various international organizations in countries such as China, Malaysia, Zambia, Tanzania, East and South Africa. So we have here an expert with a very wide range of geographical areas that she has covered, and we look forward to her presentation. Let me just add a note that now the questions that you put in will be addressed to the next three speakers only, not the earlier three speakers. And at the end of this, we will take up those questions. And then later, if we have time, then it will be open house after that. But right now, we will follow this protocol. Ms. Paddy.
Thank you very much, Professor Kamala. And thank you to GRFDT for inviting me for this panel discussion. Like Professor Kamala explained, I think my experience is quite vast. And then I'm also dealing, I couldn't stop my brain into circling, thinking about what an African migration perspective would be, gazing at two unknowns, which have a problem with data, as we have already talked about, looking at the gender lens and also trying to understand how all that is happening on the migration front and in the midst of a COVID storm. So I'll try my best to see on how I can touch on various parts. Can you hear me? I see Professor Kamala is frozen.
I hear you. Yes, we can hear you. Yeah.
So just to give a bit of background, Africa is, there are 55 countries in Africa, and there's a population of 1.3 billion with various growth rates. Some of them, the growth rate of the continent is high from desirable. And it's still, not a double digit. So we're talking about 4% economic growth rate. Issues of debt burden are, are looming over us with a lot of countries that are, quite a number of countries that are in debt distress and owing a lot of money a little bit all over the place, but particularly to countries like China, a lot in Eurobonds and other G20 creditors, as well as private creditors. So I thought that's important to have this in the background when we think about migration and where it's coming from. I also thought it's important for us to know that in terms of poverty and youth unemployment, even though it seems as though in some of the countries there was a decrease compared to 2005 levels, of the poverty rates that were going down, and you even had some countries being reclassified from middle-income countries to lower-income countries, and aid programs pulling out. Some countries were still registering very low growth rates. And then you still have quite, there's a much more literate population. Like if we talk about 10 decades ago, there's a growing private sector. So there's some good and interesting things. There's been an increased spending in terms of, from most government side in terms of health and education, even though you may have some question marks there, particularly in relation to girls' education. But there was quite a focus in the last 20 years or so in investing in these social sectors. So the expectation was that, poverty should have been really growing, especially when we came from the MDGs. We should have been looking at a different scenario when we're talking about SDGs. But we were largely looking at more or less the same scenario. So poverty is an issue, especially with youth, and then that touches a lot on women and young girls. And these are the most vulnerable pockets due to low education levels and in terms of access issues as well, that go beyond just providing programs on girl child education, but that go to the role that the girl child plays in a household. So you would say relatively that the figures that you have on people living under less than $1 a day are continues to be a problematic issue. And therefore, and then if also we look at the growing inflation rates, that doesn't really help the situation. So it's not quite surprising that from these pieces of statistics that I've given you would cause a flight off a country, and probably most likely off a continent to look for greener pastures. So at the same time, other things have been happening. Like you have a growing informal sector, that's largely dominated by, women in trade and services, because they couldn't get space in the public sector, or they couldn't get space in the more formal sectors of employment. So when we talk about, so for instance, if we're looking at rural-urban migration, there's been a lot of rural migration, particularly, I'll zoom in a bit maybe on young girls who looked at, farming as a hard life, and then could work as a domestic worker in the city. So something that's prevalent in as I've heard from other speakers talking about in India and in other parts of the world. You also see this in China, for instance. So in many parts of the world where migration is driven by work in the urban centers. But the work, in terms of internal migration, there's also been a pull factor from the cities, because that's where the education is provided. So you've got your good level of education at secondary level, but universities and higher learning institutions are found in cities. So it doesn't do much justice in keeping our young girls and boys moving to cities. So you have that also sitting in the pocket as an issue to digest in terms of understanding the impact that migration may have, or the root causes of migration. And then, fine, you have it's a growing informal sector, but we also know that women are mainly left behind with low literacy rates. Yes, even though the provision of mobile phones has largely grown up, but the use of it is something different. I think having a mobile phone and knowing how to handle it is always two different things. So of course the expectation was that the more smartphones you see out there on the continent, with many players coming into the market, the easier it should be for access, for instance, to more innovative financial services. But that is really taking us, so it's not growing as fast as one would have expected. So there's been a rapid growth of mobile money, which has really been very useful for women who have had a difficulty in accessing financial services. They can bank their money on their mobile phones. They can feel much more secure rather than moving with cash, moving from a market to home, or moving from your salary being paid in cash and for you to take it home. There's also been an increase to financial information. So I think in terms of that, we see some changes. So it's actually not surprising to see MIT do a research and basically say that access to mobile money, it lifted about 2% of the people out of poverty in Kenya. So these are some of the interesting statistics to think about. So let me zoom now on migration. When we think about intra-Africa migration routes, I think it's important to realize that Africa, the 55 countries have also been further broken down by regional economic communities, and different countries may also belong. So for instance, Zambia belongs both to SADC and to COMESA. So these are two regional economic communities that still have an influence, and not as strong as, for instance, the European Union would have on Spain, France, Germany, and the others, but would still have an impact on the way trade is handled, on the way certain policies are taken. So because we're trying to move towards regional integration, so enhancing regional integration. So therefore, it means that some of these countries, for instance, in ECOWAS, so that would cover countries in West Africa, countries in SADC covering Southern Africa, East African Community, a smaller group of countries that are coming together, but really their agenda moving much more forward on moving towards regional integration. And soon, the so-called Africa Continental Free Trade Agreement. And all these are coming up. But what it would mean that even though they're more trade-related regional integration focused, so we're looking at the trade aspect, of course, the movement of people is largely affected. So what that has meant is that there have been some other regional migration governance policies that have resulted out of this. So it has allowed people to move. But even though the number of people moving within the continent remains very small at around 7%, but it's estimated to grow for the full operationalization of the Africa Free Trade Continental Agreement. The destinations vary within the continent. People travel to South Africa, to Kenya, to Botswana, looking for work opportunities mainly, because these would be, if you like, economic powerhouses, Nigeria, Kenya, and even you have also sort of other smaller countries that wouldn't smaller in terms of population, but important in terms of the economic growth. Tanzania, Botswana, the Gambia, Uganda are countries that attract migrants that are seeking work in tourism, teachers moving across borders, accountants, domestic workers. It's quite prevalent. It's a normal scenario to see in Tanzania that you have a Malawian domestic worker, or you have a gardener who would work as a domestic worker. It's quite probable. And then others move for education because maybe the national system cannot capture all the students graduating from secondary school. So this has also allowed a flight. It's not very surprising to arrive to a university in Namibia. Actually, the University of Namibia has a large number of Zambian students there that have and then they stay on and become integrated into Namibian communities. South Africa is a very important destination. So migrants would move as far as from the Horn of Africa and coming down all the way to South Africa, passing countries like Kenya, Tanzania, Mozambique on their way. Rwanda is becoming more and more interesting because it's really established itself as a powerhouse on the continent. So that's becoming an interesting destination, particularly for education. So there are quite a lot of movements. And then of course there's movements between communities. Remember, we have quite artificial borders on the continent. So that means that there's a lot of cross movement between villages that have been split by these artificial borders. They're moving for trade, they're moving for work, they're moving for their cattle to graze, and from one to, so there's mobility and migration happening at the same time. And then zooming a little bit on looking at outside the continent, our migration routes on the African continent are largely influenced by the colonial history, and also the trade routes that you've had, as well as the proximity that we have in the surrounding continent. So it's not very surprising that migrants, for instance, from Africa, predominantly, they head for the UK, to Germany, France, Spain, Portugal, Belgium, Italy. And then, of course, we have a lot of student migration to India recently, and in the last couple of decades to China and to Russia, largely because we have had a lot of scholarship being offered in this opportunity in these countries, but also countries like Australia and the US have been interesting destination for African migrants. And in terms of arrivals on the continent, I thought it would be interesting to get a perspective that we still have large pockets of migrants. And I think the largest ones I would say would be India, Pakistan. But over the last decades, we've seen an influx of Lebanese migrants coming in, particularly to establish businesses. So they're into investment. And you are seeing more and more varied pockets of migration arriving onto the continent. But I mean, you would find African migrants basically anywhere, like you would find, in whether they're there for regular or irregular purposes. They're driven by education opportunities. Some are running away from civil war, and some are simply looking for a better life. So zooming in a bit on irregular migration. Now, the irregular migration, of course, I would try and just focus it here on particularly looking at Europe and maybe zoom in a little bit on China. Irregular migration has been on the increase, and the trend has been that a lot of younger men were crossing using the back way. So when I mentioned the back way, I would refer to irregular migration. So they would be moving, transited by buses and different types of transportation, coming from the west coast of Africa, for instance, and trying to cross through Niger and the other countries on their way to Libya, and then crossing to find their way up to Italy. And usually the intended destination would either be Germany or the United Kingdom, looking for opportunities there, or France, depending on what the motivation would be, and depending on where the migrant has an existing network of sorts. So it would be friends who have gone before, family members that have traveled before and have shared success stories. I would encourage you to look at the Mixed Migration Center if you wanted to get a better glimpse into sort of understanding motivations behind them. I think they've come up with some very interesting reports that really outline not just motivations, but experiences. UNDP also did a report earlier last year to just interview a couple of migrants that have also used the back way to understand motivations. So this has been an interesting phenomenon that has been happening over the years. In fact, it became such a troubling phenomena that I think it motivated the European Union Africa engagement to also change and take shape. And you can also see it in bilateral agreements that the EU have tried to work on in terms of curbing this irregular migration. So really trying to stop the traffic at Libya, and also trying to decongest and reduce the numbers of irregular migrants that are stranded in Libya in very, very deplorable condition. So this has been, largely the work that has gone into signing return agreements. You've also had quite a number of programs that are being run by the International Organization for Migration. They have a regional office in West and Central Africa and another one sitting for East Africa. So I would encourage you to go onto their websites if you wanted to really dig in and zoom in on the different countries. Like I said, it's 55 countries, so it would be difficult to even pick up statistics. So, but I think what has been happening also is that the number of women that are joining these migration routes is increasing. But of course, irregular migration by women traveling because they're trafficked particularly for forced labor and modern slavery reasons, if we could put it like that, that would fly in a very regular way. So they're recruited from their various countries and transported to Europe, to many parts of the world, to China, even as far as South America, where they are then exploited. So there's a lot of human trafficking that's happening, but there's a lot of engagement also with some of we would say the top countries. Like Nigeria has a very active interaction at the bilateral level with countries like the United Kingdom, and several other countries are really trying to put a stem to this. But it is not far from finished, because the methods of human traffickers are highly sophisticated as it goes in that area. I also thought to say something about remittances, because remittances are a real lifeline. They're paying education, they're paying for education, they pay for health. They also pay for the care that happens when a migrant has moved. So when a migrant moves to another country, usually a lot of these women are leaving behind children. They are leaving behind spouses, they are leaving behind elderly parents and families that largely depend on them. So they would have to continue paying for all these kind of services that have to be offered. So they are a real lifeline. And unfortunately, the numbers are not going to be, the numbers are seen to be, will be on the decline, according to the World Bank, that sub-Saharan Africa will probably see a 23% decline in remittances. So we are yet to see what that impact will have. But already thinking about the role that remittances play for families that have left behind families by female-headed households, if we could say in this case, would have a very drastic impact. Not to mention the mental and the psychosocial problems that would come with it. So then I thought to just talk a bit about COVID, if I can, Professor Kamala. How am I doing with time?
Can you wrap up in a minute or two?
All right. Okay. Then I think I can manage to wrap up. So in terms of COVID, trying to understand what's happening with COVID, there have been a lot of lockdowns. So, I'm saying that there's a slowdown lockdown, there are locked borders, there are curfews, there's social distances, there's slow economic activity, there's immigration practices that people are not used to, border posts are closed. But it doesn't mean that migrants have stopped moving around. Those between villages, the cross borders, the cross-border villages, as one would say, have continued to find other ways, because we have such porous borders. We have huge land borders that only if the unofficial ways have been blocked, people can find other routes. And one would expect that maybe there could be an outflux when the borders reopen. But then what does that mean? There are also stringent measures waiting for people. So in terms of irregular migration, I think they could be quite an increase, but in terms of regular migration, it will be quite slow in the beginning with stricter border practices. And I mean, the expectation that, reading from the different, let's say, migration authorities and migration bodies that produce a lot of this analytical work, you tend to also see that since there's been such an outcry for healthcare workers, that you could see an influx of nurses leaving the continent or leaving countries. Like I said, there is quite intra-regional migration. So that could be a plus for female nurses moving across, but that does also something on brain drain and the impact that it would have on households. So it's difficult to see how that becomes a win-win condition. I think there's also a foreseen, one would expect that there would be some kind of further more rampant exploitation for irregular female migrants who already face a lot of different problems trying to cross these different borders, usually exploited not just by smugglers, but also exploited sometimes by public officials that are entrusted to take care of them. I think another thing I wanted to add here is that what COVID has also brought out is the role of the diaspora, in responding to needs back at home. Because they've managed to step in when there is no, when you depend on you have when you deal with a cash economy and you have a hand-to-mouth kind of situation, it's very difficult when the market has been closed for you to be able to provide for your children. So, the diaspora is coming in, but then there've been some limitations, knowing that a lot of money is carried actually in cash between people. So there's still been a slowdown. In some countries, funny enough, for instance, you've had some records of remittances, official remittances slightly coming up, but maybe the assumption there is that because it's Ramadan in countries where the practice is present, so families are sending this money. So you would say sort of like advances that are coming forward to social protection measures that are being implemented within families. So you see that happening. There's also a number of domestic workers being returned, particularly to East Africa, coming from the Middle East as the impact on COVID is taking place there. There's a lot of fear on joblessness. So some female migrants have decided to stay on. For instance, you will hear from reports coming from China. Due to the issue of let's say a not very efficient way of dealing with irregular migration, like has happened in other countries. They had to be some migrants from irregular migrants that had to be repatriated back, regular and irregular. But some just feared that coming home would mean shame and joblessness. What would you do to feed a family that relies on you? So I think I have a little bit more on opportunities, sort of, but I think we can touch on that after the questions, Professor Camilla.
Yes. Thank you, Ms. Patty. You have really, in a short span, given us an idea of the intricacies, the intricate working of the whole of the continent as far as migration goes. You have told us about the different kinds of migration and the different regions which are popular as destination countries. And you have also told us about what you expect when the COVID scenario changes, or how, when the borders are open, what is going to happen. Despite all the regional and cultural specificities, overall, your message is very similar to what the others have been saying about the growth of the informal economy, about the women and girls being in the most vulnerable sectors of the economy, and therefore also being vulnerable to domestic violence and other kinds of violence. So the picture is actually pretty similar to what is happening elsewhere. Maybe the scale and the specificities are a little different. Thank you. And I think you're going to get some questions, and so we could take them up as soon as the others finish speaking. So thank you very much. And now I invite Professor Faiz Omar Mohammad Jami. Is he here?
I think he's not there. We can go to next speaker.
Sorry, is he here?
No. I think he's not there.
Oh, what a pity. Okay, we were looking forward to his presentation. So shall I move on to the last one, which is Professor Annapoorna Pandey. She's here. She currently works at the Department of Anthropology, University of California, Santa Cruz. She does research in cultural anthropology, and she was a senior Fulbright scholar working in Odisha in India. Her research focuses on the impact of skill training on the everyday life of rural and tribal women. And I hope you will add something on what COVID implies for such women. Thank you, and over to you.
Thank you so much, Professor Kamala Ganesh, and thank you all the organizers and wonderful participants. I have been enjoying listening to you all. Sorry, it's a little too early here, so I'm just waking up. And please, if I'm blabbering, if I am not coherent, please forgive me for that. So. Thank you for the wonderful, generous introduction. Let me tell you that this here, just by listening to you all, I am going to present something that I am currently working on, my latest research on the women dependents who are coming to the United States on H-4 visa. So this is kind of very much focusing on immigrants, and that too, the gender aspect I will bring in. I have studied the migrant situation in India. I have been doing research on the immigrant women for the last 30 years, myself being an immigrant woman. And I landed here and started being a social anthropologist. I started working on my kind of people coming from my part of India, from Odisha, and who have settled here, about 40,000 people in the United States. But I have been studying the women's identity making here in the Bay Area in California. But for this purpose, thank you, Professor Sadanand, for giving me this opportunity. I want to bring in my new research. So can I share my PowerPoint so that way I am coherent? I do not want to, just wait. I'll share the screen. So
would you be able to do it in about 6 or 7 minutes?
I'll just go through it quickly. I don't have to go over, but just so that way people can see that what I have here. Is that okay?
Yes, yes.
Yeah. So as we all know, the Western world has been created with the contributions of the non-Western people from Asia. And now that we know that kind of notorious achievement that the United States has made with the mostly the techies, that since the 1990s, the Indian techies are the kind of the tech experts coming to United States. So of course, they are bringing in all kinds of skills, but also at the same time, USA is putting all kinds of restrictions to control immigration. As you all know, in the 21st century, with the attack of COVID, now migration has completely stopped. So here my issue is that kind of, with these restrictions, what kind of gender norms that United States is imposing, that it is supposed to be a kind of, that a world that promotes equity, promotes kind of, equanimity and merit. But I see that there has been tremendous discrimination when it comes to the visa situation. So one such case is what United States is doing to the partner spouses of the techies who are coming or have come to the United States on what the state calls H-1B visa and H-4 visa. So H-1B visa is the kind of, that the people who come on temporary visa to work here, and that kind of, mainly to now these multinational corporations like Google, Facebook, and I can go on Zoom, what we are using. So this is again being totally kind of supported by the Indian techies. And interestingly, that the women that are coming in as dependents, they are mostly very highly educated professionals, but they are not kind of able to work here. They sign a contract that when these techies come, that their spouses would not be able to work. And they are bringing in, and this imagine, think about it, we have been talking about restrictions, I'll talk about COVID situation. Imagine these educated professionals like each one of us here, they become overnight dependents. And their dependency brings in no driver's license, they cannot drive. And their dependency brings in no bank account, they cannot have a bank account. Their dependency brings in no credit card, and complete lack of mobility. And I have been talking to many of these women, especially now on
your PowerPoint.
You cannot see? You cannot see my PowerPoint?
This is.
We are not able to see your PowerPoint. It's not at all there.
It's just a black screen.
Oh, really? But I thought I say, okay, maybe, yeah, I'm screen sharing.
Okay.
On my computer, it says I'm sharing the screen.
Okay, but not visible here. Some problem.
Oh, what do I need to
go ahead with your talk, which is quite clear.
Talk is very clear.
So we need not waste time on.
Okay, I'll be Sadanand Babu, I'll be sending the PowerPoint. Is that okay?
Yes, ma'am.
Yes.
I'm sorry that you cannot see it. But anyway, so now what is happening that these women become completely dependent. And
you can close this so that
that you can see me. Yes. Okay. Then I go back to the, sorry that for the, that I do not know how do I go back to full screen. You know, I have become I am teaching on Zoom now, but I'm still very technical. Can you all see me now or no?
We can see, but the screen is.
Oh my, okay. I have stopped sharing.
Now it's okay. Now it's fine. Now it's
fine. Good. So what
ahead.
I did, I stopped sharing. So that's why. Okay, good. I stopped sharing my screen. So what is happening that these women, that there has been a tremendous kind of disparity here. These women are not able to work. Now in the USA, there are over 4 million people of Indian origin, and the India-born population is about 3 million. So because according to the Census Bureau, so around 3/4 of the India-born in the USA had arrived in the previous 2 decades. But you know, they have done extremely well because their family income is per capita is $93,000 compared to other immigrant groups. So they have been very successful. But here I'm bringing you the unsuccessful stories. That kind of, you know, the disparity, the vulnerabilities, the precarities of these women who are coming as the skilled workers. They are kind of, you know, very educated professionals, and their precarious situation. So the new group are distinctly identified by education and occupation. They have advanced degrees in computers, engineering, and related technology disciplines than perhaps any other international migrant stream at any other time. So they constitute about, here 10% of the American labor force in fields, as I just mentioned. So this H-1B and H-4 visa, what does it mean? I'm sure many of you know these high skilled workers migrate for employment on skilled worker visa, H-1B, and their spouses migrate on dependent visas, H-4. So the dependent or the H-4 visa restricts the spouses to find legal employment or possess a social security number. Hence, all the restrictions. And interestingly, that these educated women are very skilled. I was talking to a woman yesterday because I have been interviewing that she's an architect, and here out of 3, she kind of, you know, because she was dependent, she came here from a high-flying job in Mumbai. Here she is a dependent. And the first year they got married, she kind of developed all sorts of health issues because overnight she becomes a dependent. And when she gets an H-4, now Obama government in 2015, President Obama's government introduced a very interesting initiative that's called the H-4 EAD. So that means that they can, now these dependent women can work as dependents, but there is a kind of a catch here. Who can apply, who can go for this job? If their husbands have also been selected for green card, that if their company has sponsored them for green card, then only they will get the H-4 EAD. And the green card may take a whole lifetime. Think about it. So, but with the H-4 EAD, they can apply for a job. So I was talking to this woman, this architect. She said that out of 300 candidates, the kind of her company chose her because she works on green building, and she is one of the most kind of qualified persons, more specialized. But at the same time, every moment she is worrying that with the COVID attack, now present Trump government, that who is a very popular one in India, unfortunately, sorry, I'm saying this. So the Trump, anytime they can just get rid of this H4EAD in the name of make America great again. As you all know, in the United States today, with the COVID attack, there are about now, there is 50% unemployment, 15. So about 50 million people are unemployed, which is never heard of since depression, that this is something kind of unheard of, which has happened. And now the Trump government has every reason kind of, has the kind of, justification to get rid of these H4EAD. So the vulnerabilities, what I'm kind of explaining with the COVID attack. So we see that what is happening to these women. Many studies, because in today's presentation, I've been listening to the victim status with the migrant situation, with their kind of the multiple vulnerabilities. But I want to use a different lens here. I'm kind of, I'm bringing in a kind of a vitality among these women. What amazes me, that in many cases, these women, that even though United States is really emphasizing the visa, is shaping the family structures and familial relationship for these high-tech workers by reinforcing a patriarchal family form with the man as the breadwinner and the woman as the homemaker, the private sector labor market is benefiting at the cost of the well-being of migrant families. Think about it, that when a woman is not well, we talk about that, that kind of the woman's role in the family for self and family. So in my preliminary study, I agree with other researchers that who are saying that yes, women are the victims, that women are developing kind of the victimhood. But I want to emphasize, even under this COVID attack, the H4 visa holder women are developing a coalition and have formed the kind of visa holder network groups on Facebook and other media groups that and now in Zoom meetings that and they are that kind of, and for support and organizing. In this study, I refrain myself from treating these women as victims of patriarchal values created by the USA visa system. Rather, they rise to become game players in order to make the most of the situation and create various opportunities for themselves when all the doors for them are closed. Because I think this is where I find that's where the crux of my research is. That just to come back to I can go on this H4 visa holder spouses. Who are they? They are absolutely that kind of, imagine that when with being highly qualified when they come here. So this visa, H4 visa, is dubbed as the depression visa. Think about it. So the depression visa and the prisoner visa, or the kind of, very much, since the women who are often highly qualified and the work experience become frustrated and depressed, that in the traditional housewife role. How long will they? So because many of these women have been telling me that they're jealous of their husbands going to work, because when they are staying home, they cannot simply, they find just going to work, that kind of, that, oh, I cannot go. Why cannot I go? That kind of, imagine comparing their life before. And that it also affects their self-confidence, their idea of self-worth, constrains them financially, disables them in social settings, and provides no opportunities to build economic or human capital and skill sets, of course. So, and the precarity, I can go on. And especially with now, you must have read that now since kind of, that with the job situation, that unemployment, who are expanded or who are expandable? These H1B visa people. And imagine, they really need only 60 days, that they only have 60 days to be re-employed. If not, they're deported. So it is not just the women, what happens to their children? That kind of, just, so it's a kind of, vicious circle, that what is being created here in the United States. So I I can go on, but so the precarity, but I just have 1 minute.
Wrap up, Professor
Okay,
Pandey.
so I do not want to go over the case studies, but let me just kind of wrap up in 1 minute. So the constraints are many. The patriarchal values and conventional gender relationships are reinforced. And numerous cases of domestic violence, family conflict, separation, and to the kind of also an extent divorce. Women being isolated from their familial support system, and this unequal relationship is created. So the deep shame and failure and so on. So my conclusion that here I want to bring, and with the COVID situation, that based on my several in-depth interviews, I observed that except for a handful, a majority of these professional women, especially with the EAD status, want to continue and fight against the present visa system. Many of these women have filed petition to the local congressmen and women to extend their EAD and fight against this Trump rule and the the policy, since this workshop is also on policy, and to extend their ESC and expedite their H-1B. Also, several Facebook pages have been introduced for networking among the H-4 visa people, and also films have been made. I'm interviewing many of them. And now 4 members of Congress are of Indian origin. 3 of them in very, very visible, powerful committees. They are building coalition to represent these women at the highest level. So groups like this H-1B, H-4 visa, EAD holders, Facebooks are very, very active. Women are carving out niche, like, that they're becoming professional dancers and musicians, creating space for themselves. So my conclusion is this, that the development of new patriarchy to control and subjugate highly educated professional immigrant women by restricting their economic freedom. This is what Foucault had in mind when he introduced governmentality. Imposing normative gender role. The irony is that these transnational women left India to escape patriarchy. Now they are forced into a new world, new kind. Building coalition with the political leaders of Indian origin who are visible in order to articulate the grievances they have against the state. Through Facebook groups, they are creating support groups of people like them. And these groups act as surrogate family where they freely discuss their problems and are supported by various members to find solution to their problems. Thank you so much.
Thank you, Professor Pandey. This is a very fascinating tale that you have presented. And, it's a little bit different from all the other presentations which were focusing on the poor, vulnerable women from poorer socioeconomic sections. But, your material shows that, migrant women across classes in the time of COVID, especially if they are in the US, they are also subject to patriarchal harassment. And so, I think it is important to keep in mind, while we do focus on the vast majority of women who come from very poor sections, that it is not as though women from other sections are free of patriarchy and very gendered kind of policies. So thank you for that. And it's also good to know, and perhaps that is the difference, that this group of educated women are able to form a coalition and fight it out, and the others are not so articulate and they're not able to fight it out. So there is one difference between these classes. But thank you for this.
I want to add a word of caution, Professor, here, that let's not just go for this binary that, either they're everything is working out, everything is not working out. But these are the kind of in between, these small steps. That's where I see the kind of, the action. Thank you.
Sure. Now the request to Ms. Paddy and Professor Pandey is that you take a quick look at the questions. You don't need to read them out, because everybody has them on their chat box, they know. And if you can consolidate a reply to your 3 or 4 or 5 questioners and maybe present for about 5 minutes each, is that okay? Is that fair or unfair? Can you manage in that time to give a response to the questions that have come to you?
I'm just reading.
Yeah, Ms. Paddy?
Hello. Okay, I couldn't unmute myself. So I'm going through the questions. Do you want us to go through the questions and not ask the participants to ask them, but just answer them as they are.
Because we are running out of time. It is, it's very interesting that it is going on, but as moderator, I have some duties and I have to keep this. Maybe we could go on in total for another 15 minutes. So I would request you to take about 5 minutes to answer these questions in the best way you can. And after that, if anybody else wants to, any of the other participants, the speakers want to add a word or two, we can do that and wind up the session. Is that okay, Sadanand?
That's fine.
Okay. Okay. So, yeah, either of you can start.
I can go.
Yes. Yes.
Thank you so much again. Oh, fantastic questions. My goodness, you are making my research more enriching. First, let me go to one question that came from the audience. Sorry, I did not write down the names because it's been very quick. That what about the male spouses? Yes, such a fantastic question. That we see there are many male spouses who are also H4 visa. But interestingly, what is happening that many of my interviews suggest that when it's the male spouse, that in many cases, they are forcing the H1B, the woman, to go back to India. That kind of, that so interesting. So that so this woman that I was talking, she said, if it was not a male, would it have happened? So, in many cases that H4 male goes back, man goes back, and the woman works here, 6 months here, 6 months there, and it's not working out. So that what happens? They just migrate back either to Australia or England or back to India. So that's one. And many cases also male spouses, they become students. That many of these kind of, so that way in order to earn a degree to when they can apply for H1 visa. But H1 visa is not that easy, that even you get the job, but your company will be sponsoring you for the H1, but there is also a lottery for H1 visa, only 65,000 per year. And there are about 3 million people apply for that visa. The company applies for their employees. So it's not that an easy track. So I see a tinge of patriarchy there, that kind of to see that or kind of a different kind of a balance. But also, let me tell you, I will be very wrong. I don't want to use my feminist hat here. I was talking to these women. They are telling me that men are much more understanding too now, because they are equal partners. They are cooking and cleaning. They are helping them. They are trying to understand the women's situation. So there is a lot of kind of, level playing also is happening. So this is something under the circumstances that what is happening, that must be mobility, must be playing a very important role. And somebody asked that under the COVID attack, that kind of, now since the visa situation is very precarious, what is going to happen? What about the female migration? I wish I had a crystal ball that to tell you what's going to happen, but it is a very, very difficult situation now, let me tell you. And imagine the stability, insecurity is not easy. People cannot even plan to have a family. People, because many cases, children that they may remain, they kind of become citizens of United States, whereas parents are deported. Imagine that kind of a 3-year-old, 5-year-old, what's the situation? And another very important question that came, that what is kind of, that the affecting that, what is the Indian women's health insurance policy for Indian immigrant women in America? How American government is taking care of? Fantastic question, because on H1B, that if their spouses have the kind of work visa, they have insurance. That's kind of, one thing that is, so they have the health insurance, but they may not have other privileges. That many of these women, they do not know even what they can do because of the lack of support system. So, and thanks. Okay, any other question? It was so, thank you. And how it is affecting their domesticality, how is affecting their family. Yes, and Can you say more about who the Indian origin political actors are who are assisting the women H4 visa holders? I definitely am going to put it on my, it's there on my PowerPoint. I'll be sharing it with Dr. Sadanand and the organizers. Because of paucity of time, I don't want to go on. This is, in fact, again, this is my new research and I am excited. I'm very kind of, and this is the first time I'm presenting to you all. So I'm now excited to do some more in-depth research on this. Thank you.
Thank you, Professor Annapoorna. Over to you, Ms. Paddy.
Okay, thank you very much for the wealth of questions. I actually almost feel underqualified to answer some of them. And I think there is a question there that remains hanging by Rajesh Singh that I think is not directed to me, so maybe we would need to address it. So I was starting from bottom up, looking at the question from Robert. Yes, indeed, he talks about, isn't it such a Western construct for us to use the gender lens as looking at progress? I totally agree. We need to totally look at other aspects of human development when we look at progress. And I think here, there are many other measures that look in terms of instead of we need to package it. We need to understand wealth. We need to understand issues of equity, and we need to understand issues of access as well. So I totally agree with you. And then I think you raised the question there, sort of talking about how we can study migration and the diaspora and how we can use it to depoliticize migration and diaspora. Well, it's a big topic, and maybe I will ask others who are maybe more vested in this one to unpack it a bit differently. But I think that the engagement, in short, I was just going to say that COVID, what it has done is to really show what's happening on the scene when there is no movement, when the donors are not very clear on what kind of commitments they will give because they're just not clear on what's happening in their home ground. So it's really brought back governments to think about who they can rely on. And, and here, who are they rely on? You rely on your citizens both at home and away. So I think in whichever way we look at it, whether we're engaging diaspora at the very local level, so through initiatives that are being done at the very local level, or these are being upscaled in countries where they have engaged the diaspora in a much more systematic way, to not just contribute, to look at them in terms of contributors of remittances or contributors of financial resources, but really look at them as part of their human capital. This is part of the wealth that they have. It's just not sitting with them for one reason or another, but it doesn't stop also the diaspora outside to engage much more. And I think even in the African scene, we've even taken to one step further where we take it to the regional level, which comes a bit closer to the country, but then we've upscaled it to the continental level. And the African Union is really looking at frameworks and trying to digest and work together with countries and say, how do we engage diaspora much more? And how do we facilitate life of diaspora to make it easier? There are countries in many countries, and I guess in India, I've been following for the last couple of weeks as well. There are some things people in the diaspora cannot do back home simply because they decided to cross the border and go and get some work. So some of these things need to be ironed out at a national level. Some of these things need to be advocated at higher levels so that it becomes the new normal. And then there was another question that was sort of raised. I think maybe I covered it as well, that from Prakesh Chitor. Thanks for that question on sort of looking at policy mechanisms by government for documentation of migrant laborers in the region. Now, I think I'm taking advantage of trying to understand this as documentation of migrants who have left the region, because when I leave my country, there is nowhere where I register, and that goes for any kind of migrant. You don't have a prerequisite to register, whether you leave for whatever motivation you have. I know that in other countries, for instance, in the Philippines, there is a policy that you have to actually register with the overseas institution before you can travel to become a domestic worker or whatever other work you would do in construction and so on. So in other countries, you have this setup, but in a lot of African countries, you don't have that setup. People are free to live and where they go. So data becomes then a problem because you're not able to track people unless they willingly come and register with you. But I think that we have the mechanisms, we have the houses for data. So it's just about us coordinating ourselves, speaking to each other, because this data is sitting with somebody. Somebody knows where all these migrant workers are, whether you're documented or you're undocumented, in one way or another. So I think there is a lot to do there with data. And I think that there's also a lot to do with equipping the national statistics offices, because, post-COVID, what's going to happen is that we're going to ask our national statistics officers to give us data. But, if we haven't equipped them well enough, to capture gender disaggregated data, we haven't equipped them enough to be able to produce other kinds of disaggregated data. So it means that when it comes to you counting, who was in the informal sector that was supported, we don't have this. I mean, it's already a problem for governments to know how to provide social safety nets, because sometimes they don't even know where people are, because everything is relying on people who remain still uncounted, undocumented, unidentified, as in they don't have their identifications with them. So that I think would help in terms of documentation. Then there was a very long question there that, Annie, I'm sorry, Annie, I've just seen your question now. I think I kind of skipped it. You were saying, looking at migration within African countries as inner migration. Are the different characteristics, cultural as well as the policy differences, are they different? Definitely very different. One country is as distinct from another country. Languages are different. But I have to say that there are a lot of similarities because of the proximity that we have. And you are right, the borders are quite artificial. In that sense, it means that what has happened, and this is something that has been, talked about since, I guess, the days the borders were created. They're quite artificial. And in some cases, they've even brought about conflict. And, we're thankful that there are a lot of programs that are working with the community levels to bring much more social cohesion around resources around the border, which has, resources that are split between borders. But yeah, there is, and I think maybe with COVID, I don't know, will we see more flexibility of the borders? It's difficult to say because everybody wants to protect themselves. A simple example is that because the number of cases in Tanzania, which is a very important country with the Indian Ocean, largely having the Indian Ocean access. So a country like Zambia, which is landlocked, we're completely landlocked with 9 countries surrounding us. We rely on Tanzania for all our goods to come in. And now that border is closed because the number of COVID cases have increased in Tanzania. So what does that mean for, families and livelihoods that first rely on border activity, and next the different families thousands of kilometers apart that rely on these trade posts being open. So yes, I think there will be something to be said about that, about how, I don't know, flexibility is a difficult thing to say. And then I think that there was also another question. There's a question from Dr. Aparna Pandey. I have the feeling that maybe I will, Professor Kamala, maybe that can be looked at. I'm not sure if I should answer that or somebody else can answer it, talking about the nature of work in the health sector.
You could leave for the moment, because I'm going to give one more round to each of the speakers, 1 minute each, which you will get. So by that time, you may want to answer or somebody else would have answered it.
Okay, so maybe that one I'll leave it and then I'll answer the next 2 and then we can close up on this one. Yeah. I think I got a question also from Professor Binod Kadri. Thank you very much. And I think I feel more than privileged to be in the same room with you, knowing that I've read, a lot of your work and also the World Migration Report published by the International Organization for Migration. So that's, I feel very honored to be asked a question from your side. And yes, you asked an important question. Will COVID affect female international students, particularly traveling to India? And my question, I think, would have been, if this question was phrased in general, I would have said it depends on the destination. Particularly for India, a lot of African countries are relying on, they send not just their children, but they're sending, adults are also just making their own journeys to be enlightened and to be to get a formal education in India. I think we have very strong links between the continent and India, and with a lot of African countries. And I think that we are also seeing that we didn't, for instance, speaking from a person who comes from Zambia and who's also followed a bit on looking at STEM subjects and how they're promoted, access to the US market has particularly been very difficult for education and even just in terms of employment. So for us, when we look at India, it's sort of the next destination if you want, if you want to really tap into that level of education for the STEM subjects. I also think, but will it affect? I think it really depends. It will depend on the fluidity of the families. Most of the families that send students to India rely on their private resources. I think there's no active bursary as far as I understand, unless I think it's run within government circles. So I think it will really depend on the fluidity. But I think in terms of if migration has to cut to a destination, let's say Australia, which which is much more expensive, or to the US, if those options remain open for families in the middle class, I think India remains an open option. Because we're relying on it actually even for other things. To China, it's a little bit, we have, I think for the moment, things are currently closed. Actually, a lot of students who are outside China with visas have been canceled because they're trying now to figure out what will happen to the new ways of migration. And with the other destinations, I think it depends a lot on that. And then the last question that I think I will address was very packed, a long one about racism, xenophobia, apartheid, and the role of women. I think simply coming from a very simplistic view, women are peacemakers. So somebody asked me, what role can women play in what role can women play in xenophobia? I think we're peacemakers. We're a voice of reason, and I think that we're also very good facilitators. So I think it's all about ganging up and bringing people back together on the drawing table. What is good is that we have political leaders, both in countries like South Africa, where we had your question referred very much to issues of xenophobia in South Africa. I don't have latest stats to show what's happening in terms of the impact of xenophobia, of COVID on xenophobic attacks, but all I can see from media reports that I see is that there's a lot of migrants coming together, trying to support each other as they get even into more informal work under COVID. So if there was anything that was more informal, looking for vegetables to sell so that their families have a pot of porridge. So I think that there's a lot to be said about how communities can come together as well in times of crisis. And it's good to see that, political leaders, even at the level of SADC, for instance, are sitting down together and saying, how are we dealing with this to ensure that there's social cohesion? Because there is a lot of panic when people are crammed up together in homes. There is a lot of uncomfortability and difficulty in understanding what the future would be like. But I think, Professor Kamala, I will come and touch on, like I said, with opportunities later on, since I've covered this one. There was a question on modern slavery, and I would just, it's about debt bondage, where you are, you work for free to pay for your debt. This child slavery, forced marriage, what have I forgotten? Forced labor is in there. Domestic servitude is also in there. So where you're basically made to work through force or intimidation, and this is what modern slavery is. So when we talk about human trafficking, I think it would be a component. It would be a component that's sitting very close to modern slavery. That's maybe a little bit more packed up. So with these questions, thank you very much. And then I think I will wrap up in the last session. Thank you, Professor Kamala.
Thank you very much. Now the 5 speakers, if there is one point that you want to make in 30 seconds or a minute, you are free to do so now. There are many other questions, but we do have a time a deadline kind of a thing. And Sadanand, I guess we have to wind up in 10 minutes.
In 10 minutes.
Yes, so a minute each for the speakers. If there's something you still wanted to add, please do so. Beginning in the same order with Professor Margaret Roberts, and then Ambassador Seth, Aparna Rayaprol, and the other 2, Paddy Sianga and Professor Pandey.
Yes, thank you so much for that. And again, it's been such an interesting discussion. Really kind of learned a lot from the other presenters. I'll just finish off with the question I was going to talk about was what happens about coming out of this. And there are lots of debates about how a feminist approach might be important in a post-COVID recovery. And we've seen a lot of these issues around the vulnerability of different workers, intersectional vulnerabilities, exploitation. And there are a lot of groups that are working on trying to prioritize a feminist agenda. So just some interesting stuff. Oxfam is taking a lead. There's a democratizing work collective that a group of European academics has launched. Hawaii, I put that message in the post, they have developed a feminist economic revival plan. There's a Feminist Alliance for Rights. The Coordinadora Feminista 8M in Chile is a group that has released a feminist emergency plan in the face of coronavirus. There's the Feminist Agenda for a New Green Deal in the US. And what I would just say, to finish off, 2 things. I think Pratap Banu Mehta had a very interesting article in the Indian Express on May 14th, where he talked about solidarity as being about justice and rights and institutional obligations and processes and accountability. It's not about sympathy. It's not about care, it's about rights. And I think thinking about Naomi Klein's arguments for shock doctrine, what we have to do is we have to have plans that we can pick up and force into the plate of policymakers in the wake of this crisis. And so I really do think some of these arguments for feminist agenda for recovery could possibly get the ear of policymakers. I mean, there's obviously going to be resistance, but I think it's a good moment to start actually being ambitious about some plans that could remake the situation. And I'll just leave it there. Thank you so much.
Thank you. Ambassador?
It was very, interesting seeing the very many similarities, that we have seen in all the presentations regarding the gender issue and how, irrespective of the socio-economic strata that they come from, women are more vulnerable as compared to men wherever they are working. And one last point I'd just like to make, that in a post-COVID-19 world, as Professor Margaret has said, we need to really have women's voices. I think women are generally more environment friendly in their approach, and they are more empathetic, and they understand that living in harmony with nature is most important. And also we could take these traditional approaches that we've had in various cultures across the world to developing a more environment-friendly, sustainable post-COVID world, and for employment and for migration. I think migration is going to be affected now because the jobs are being lost all over. People will work more from home, and I think that might give women workers some advantage, at least in the services sector, where IT is, the main driver. And I think we need to now also focus, all governments need to focus on workers who are already there, domestic workers, and at all levels to ensure that their safety and well-being is ensured in any country in the world, especially in the Gulf region. Thank you.
Thank you. Dr. Ayaprul, Professor Ayaprul.
Thank you. I think I'd like to piggyback on both the previous speakers in their wrap up. And yes, a feminist understanding of how to approach matters, especially in policy. I think in academics, we are able to use the feminist approach, but policy and data collection, I'm sorry to say, is still extremely androcentric, and we need to see more. The gender blindness needs to move out of policy making. It needs to move out of, you don't see the women doing the work when you collect the data. So that needs to change, the way we ask our questions. And when we come to policy, I think one of the things that Amba Pandey had raised for anyone, and I think I'll try to answer that, although Ambassador Seth has touched upon it, are women going to be more vulnerable in terms of finding work, because work itself is going to be difficult? I don't think so, because I think women will prefer to work, whether from home, whether to get out and run away and do the domestic work. They will be the ones to grab any opportunity, even if they are shortchanged and paid less, unfortunately, because they are the most vulnerable in many ways. Whereas men will still be looking and struggling more because they have not had the same risk-taking history that women have had. So I don't think women's opportunities will fly out of the window, but sure, I don't think then another, Ipsita Pradhan had asked whether their wages will go up. Unfortunately, I don't see the scenario of wages going up for anyone at this particular point of time. It is going to be pretty hard, I think. So the vulnerabilities are going to be different, and we need that feminist approach to be able to understand and move on in every sphere, I think. Thank you.
Thank you. Ms. Paddy?
I think I was, I think it's very difficult to add after the three speakers, but I'm thinking about, we have a lot of opportunities that are coming out in this period of resetting and thinking, to think about promoting safer migration pathways, but not just in a very gender blind way, but that really take account of women as part of that. Because I think for a long time, at least from the African side of things, migration was really looked at as being very male dominated. So I think there's something to be said about, you know, the kind of practices that are out there and the kind of information that goes out there from governments. And this would be very important in sort of moving, ensuring that women are also, you know, that they are migrating in safer ways. And I think there is also something to be said about being united on the African front when we're dealing with Gulf states and when we're dealing with countries where we have where we have huge pockets of female migrants. So I think there is something to be said about how we set very clear criteria there. And I think there is also something to be said about, you know, when we've, you know, Africa is really looking at the intra-Africa continental free trade area as being the thing that will take the set off the continent. But I think we really need to look at who is moving, you know, and are these women educated in those subjects? Because still until today, there's still less and less women who are less and less girls, first of all, starting there, who make it into these STEM subjects, and then you know, and it goes on. So if we're looking at contributors in terms of migrants who are coming up to contribute to continental growth on the economy of the continent, I think you would really need to start from the education. So that still remains quite important in terms of understanding increased opportunities for women in education in STEM subjects. And the last thing I just wanted to say is that, you know, on the continent, we know what resilience is, because luckily we were able to avoid the negative effects of the global financial crisis of 2008, but we saw what Ebola did. We've seen what pandemics have done. We've seen what HIV/AIDS has done to families and how women have been affected. So we do have examples of how we can deal from a very feminist perspective of how we can respond to pandemics. Thank you.
Sadanan, can I wind up?
We have somebody to vote of thanks.
No, I need to.
Can I just share my thoughts?
Okay, yes, of course, yes. Yes, sorry.
Thank you.
Sorry.
Thank you.
Yeah.
You know, after listening to all the presenters, I just I would like to address a couple of questions, and just to wrap up that there was one question from Nokia 8.1. Sorry, I did not have your name. That is patriarchy changing in its form only? So I would piggyback, and I would definitely add a footnote to what our presenters just said, that it is, I would say that let's just at this, it's time that we realize there are many different forms of patriarchy, which we all know, that many realities. And when the state is imposing a kind of, the patriarchy that presenting women, mostly, majority of the kind of dependents are women. I don't want to generalize that here. In response, the women are coming forward. We see a kind of a resilience, a kind of a revitalization. And that's what is very refreshing, that a kind of a new kind of coalition with the political leaders, with the supporting employment agencies, and a new kind of activism emerging among these women using the social media that to work against injustice. So I would like to see that more. Yes, it's happening kind of, in my study here in the diaspora. But when I was studying the migrant workers in India, I see there is a kind of a disconnect. So I think it's very important what Professor Raipol just said, that feminist agenda is not just to be confined in the classroom and in our research. We really need to take it up to the policy making. So this is where that kind of women leaders play a very important role, academicians and researchers. We really need to think about that. And coming back to that kind of my last point that I want to make, that is there a discrimination based on the origin here in the United States? Yes, definitely. There is, color plays a very important role. So that kind of, the brownies versus the kind of the whites. So whatever we say, that white or the white is not looked upon as a kind of a very much there. Nobody talks about the race when we talk about white, but everybody else belongs to the kind of, the ethnic group. So I think, yes, it plays a very important role, and I will leave it there. Thank you again.
I want to end on a note, a slightly different note I want to strike. I'm not making any comments about the proceedings. They have been very good, very enriching, with great participation from everybody. So really, thank you, GRFDT. But apart from the fact that we are in an unprecedented situation of COVID, everybody says, and it is true that it is unprecedented, but there is one more thing that is unprecedented for us, most of whom are social scientists, policy analysts, activists, that while a phenomenon is in progress, the COVID started a couple of months ago and it is in progress and it will go on for some time, it looks like. So even while it is in progress, we are having this unprecedented opportunity to already look at it, look back, look forward, analyze it, and perhaps we therefore have a chance to even change the course of what it would be in the next few weeks or few months or maybe 1 or 2 years to come. So I think these kind of meetings make it easier. I mean, it is far simpler, even in non-COVID times, to meet for a conference and exchange all these ideas in such a compressed and sharp way within, let's say, 2 hours, is not possible in a normal conference which happens. So this kind of conferencing, which has been kind of enforced upon us, I think we have made very good use of it, being able to comment on the situation even as it unfolds. So please note, this is something unprecedented in social sciences, which are generally doing things in with retrospective views. The second thing is that, it is possible to say that, yes, these inequalities are there. We live in an unequal world. So COVID has come into an unequal world. Our immediate task is to respond to it in an emergency, in an absolute emergency-like way. So while what you say may be true about the inequalities, we can't do much about it at this moment. But there are two pointers to two counterpoints that one can make, which is that COVID is here to stay for a little long time. It's not going to go away so soon. So even now, pointing out to these things would make policy as it is emerging, maybe it can then take some of these points into account and be more sensitive to the vulnerable segments. And the other thing is, the post-COVID era is already being thought out in various countries, in various economies. They're already making plans for a post-COVID scenario. Maybe they are being too hopeful, but it is happening. So it is now that we need to, it's not as though let us wait till the emergency gets over, but even while the emergency is going on, it is now that we have to bring these points really to the attention of the people who are making policy, and keep stressing that what we need to go back is not to the old normal, but to a new normal in which gender, and there are other parameters as well, but in which gender has to be a very, very fundamental parameter. So thank you, GRFDT, for making today possible, and all the previous sessions and the sessions to come. Thank you, everybody. It has been a wonderful time for me as moderator.
We have a panel thanked by Yanni. Annie.
Hello.
Yes.
Yeah. So I'll be trying to make it very brief after all these very much engaging talks. Firstly, I want to thank GRFDT team for this wonderful opportunity and the platform to give all these research scholars and the academicians from all over the world to bring them together and to engage. Hello?
Hello, we can hear you.
Oh, could you hear me?
Yes.
Yes. Oh, okay.
Yes, we can hear you.
So, yeah, I want to thank GRFDT for this opportunity, for bringing all the scholars and the academicians from all over the world to engage on these current issues during this pandemic time. And secondly, I want to thank all these panelists, namely Professor Kamala Ganesh, for not only keeping the track on the time, but also for her very engaging questions and the issues that she raised on the respective topics. I want to thank Dr. Amba Pandey for her welcoming note. And secondly, I want to thank all the panelists, namely Professor Margaret Roberts, Ambassador Manju Seth, Professor Aparna Pandey. I'm very sorry that if I don't pronounce the names correctly. Then I want to thank Ms. Paddy Sianga. And lastly, I want to thank Professor Annapoorna Pandey. And I would like to note that GRFDT is collecting and preparing a database for all of our scholars. And so please share your bio information and profile on phone numbers on the convener at grfdt.com. And finally, I want to let you all know that for those who are interested on the Gulf migration, we will be having another special panel discussion on the 27th of May. And last but not the least, I want to thank all the participants for this very much engaging discussion, questions, and that's it. Thanks all.
Thank you, Yanni, and thank you all. We'll stop here.
Thank you, everyone.
Thank you so much. Thank you.
Bye. Bye.